down. So what areas are additional? Of course, chin would be additional, arms are additional, medial thighs are additional, upper back kind of buffalo hump area, that's additional, and then kind of subaxillary area or lateral breast area would be considered additional. And then of course in men, if you're doing liposuction of the chest for gynecomastia, then of course that would be considered additional as well. Okay, all right, so now we know what it means. So the next step is, well, what do I have to do to prepare for a liposuction case? Okay, so as for all surgeries, I do liposuction under general anesthesia, okay, and therefore we do have to get your labs, okay, which include your CBC, your BMP, okay, your HIV, your pregnancy, and then your coags, which is your PT-INR. That's the same thing. PT-INR is the same thing. And then your PTT, which is separate than your PT-INR. Okay, you need all those labs. You need your EKG, and if you're over 40 years of age, then you need your chest X-ray. Okay. Now, in terms of your labs, the question that always comes up is your hemoglobin. What does my hemoglobin level have to be? Well, ideally it should be 12 or above. Okay. Now, if it's between 11 and 12, then the cell saver becomes mandatory. All right. And if it's below 11, then we shouldn't be doing the surgery. You have to do something to get your hemoglobin level up, okay? What does that mean? You can take your supplements, you can take your iron, sometimes that requires an iron transfusion, but you have to figure out why you're so anemic, and you gotta get that hemoglobin level to at least an 11, okay? So 11 to 12, cell saver mandatory, 12 and above, cell saver is optional, but I highly, highly recommend it, and we're gonna talk about that here in just a little bit. Okay. You have to start taking your supplements, okay? So I just alluded to that. You want to take your iron supplements, okay? So you want to take your Floridex, your Hemaplex. Those are two that we recommend, okay, in terms of building up your iron levels and building up your hemoglobin levels, okay? Also, vitamin C helps because it helps with the absorption of the iron. And then, of course, the folic acid, it also helps your hemoglobin levels. So those are the four supplements that we typically recommend are the Floridex, the Hemaplex, the vitamin C, and the folic acid. You want to take these starting at least, a month to 45 days before surgery. It's really no problem if you started before that. And if you want to check your hemoglobin levels, and see kind of where you are, where your baseline is, that'll kind of tell you how aggressive you need to be with the regimen. Okay? And for liposuction only, I'm not talking about BBL, remember, we're talking about liposuction. You want to be near your ideal weight, okay? Because the closer you are to your ideal weight, the better your long-term result is going to be, okay? So as opposed to, say, a BBL, you actually want to, for the best kind of results with liposuction, you want to be, in a normal weight range. So BMIs of like 25, okay, 25, 28 or so. Once you start getting above 28, we start hitting our limits, which I'm going to talk about here, your max removal. We're going to start hitting our limits here in Florida, so how much we can remove at one time, okay, which is 4 liters. So you want to be close to your ideal weight when you're talking about liposculpture and liposuction only. All right? Okay, so if questions come up and they're like specifically about things that I'm talking about, like say about pre-op for liposuction right now, I'll be happy to kind of take a couple of those questions. But like I said, we have a lot to cover today, so I'll keep kind of moving along. Okay? All right. So we got everything set up. You're ready for surgery. You've done your labs. You got everything into us, at least 2 weeks before surgery. And so now we're ready to go. Okay? So you come here. I always see all my patients at least 1 day before surgery. Okay? Because I want to make sure that we have enough time to just be able to talk, to go over your physical exam, to make sure I understand your expectations, and to be answering all your questions. Okay, so we have a very kind of relaxed atmosphere here. You have plenty of time to talk to me. We want to make sure that you want to show me any vision boards or things of that nature, so that we can understand exactly what the expectations can be. And of course, it's my responsibility to let you know whether your vision board or your wish picks are realistic, and and what are kind of what are realistic expectations for you in particular as a unique person, as a unique patient. Okay. And then of course I have to talk about kind of what you need to do post-op to maximize your results. And then of course we talk about any potential complications, so you're aware of those as well. All right, so that we do the day before surgery. All right, and then comes surgery day. So surgery day, a lot of the questions I get asked is how do I perform my liposuction? What are some of the different techniques that we use? What do we do in the OR? Okay, so number one, like I said before, I do all my major liposuction cases under general anesthesia. Okay, why is that? Because when we're doing 12 areas, plus potentially arms and medial thighs and things like that, it's a lot, okay? It's a lot for you to bear being awake, but also the only way that you can do awake liposuction is when you use lidocaine, right? So in that tumescent fluid, which is the first step to any liposuction case, is you actually instill fluid into the tissues that we call tumescent, and that fluid typically has epinephrine, and if you're doing it awake, it requires lidocaine, okay? If you're doing it awake and you're doing a large areas, you're gonna hit a limit as to how much lidocaine you can give a person before it becomes toxic, okay? They can be very serious side effects from lidocaine toxicity, okay? Including cardiac arrest, all right? So that's why I like to do my major liposuction cases under general anesthesia. Therefore, I don't have to use lidocaine at all. So zero lidocaine, which means zero chance of lidocaine toxicity, okay? And I use only the epinephrine within the bags to minimize the bleeding during the procedure. So I use a tumescent fluid. For most cases, for most people, we use about 2 liters in the front, 2 liters in the back. So it's about 4 liters of tumescent fluid that we use. I'm saying that as an average. Some patients that are smaller require a little less, and patients that are bigger can require a little more. But the thing is that I can put as much tumescent fluid as I need to make sure that I have enough, vasoconstriction, less bleeding that I need without having to worry about potential lidocaine toxicity.
Why do some patients want to do liposuction awake, and do you offer it?
So I don't offer it for the very reasons that I just stated. For big areas. If we're doing a small area, like say we're doing just the chin, or we're doing just the arms, then yeah, that's okay. We're doing small areas and we can do that. But I don't offer it when we're doing, Lipo 360, liposculpture, because again, the patient is uncomfortable. I can't be as aggressive as I want to be, and I want to decrease that risk of potential lidocaine toxicity. So I avoid using lidocaine altogether. Why do some patients like to do it? Because they're afraid of general anesthesia. That's really the main reason. And honestly, once you really get into the general anesthesia and the fact that pretty much all patients are healthy, they're young, they don't have heart conditions, they don't have lung conditions, because otherwise we wouldn't be doing the surgery. The risks of general anesthesia are very, very low, especially when you're working with people that you really, really trust. As you all know, you've seen Raquel all over our stuff at Pure. You've seen her at Dr.Earle as well. I've been working for Raquel for over 2 years now. She's our CRNA. She's truly, truly excellent. I only work with her or her husband, Carlos, who you may have also seen. They're both awesome, and I trust them completely. And so that's why I am super comfortable doing these procedures under general anesthesia. Okay? All right, what type of lipo do I use? I use the micro air, which is called so it's called PAL, Power Assisted Liposuction, okay? That's what we use here. So it's that machine that you've heard in some of our videos. You go, you hear that vibration because it kind of moves the cannula back and forth, and it makes it easier for the surgeon to be able to pass the cannula, and so it's less traumatic for the patient and easier on the surgeon, and that's why we use the power assisted liposuction.
For Lipo 360 cases, how many incisions do you make and where are they located?
Okay, that's a good one. I probably should have added it here to the op. So how many incisions do we make? So in the front, for most patients, we do 3 across the bottom and then 1 inside the belly button. So that's 4. Now, if the patients have a longer torso or prominent ribs, that makes it a little bit more difficult to come from the belly button to the area just below the breast, then sometimes we put a couple incisions just below the breast in that kind of breast crease area. In the back, we typically do 5 incisions. Again, 3 across the bottom, 1 in the mid back, and then 1 in the upper back. Okay, and that way we can get to those areas there. So 4 in the front, 5 in the bottom. And then, of course, each additional area will require its own incision. So the thighs require additional incisions, arms, chin, of course that makes sense, right? Okay, so that's a great question. So we talked about incisions. The other thing that I like to use for all my patients, okay, it's mandatory with a hemoglobin 11 to 12, but highly, highly recommended for all patients, is the use here of the Cell Saver. Okay, what does a cell saver do? So we just talked about briefly is how we use tumescent fluid before we do the lipo. So we instill the tumescent fluid, then we do the liposuction using the power assisted liposuction, and what comes out is fat and a combination of fluid and blood. Okay, so that tumescent fluid, that fluid and blood gets then separated out from the fat, and it gets run through the cell saver machine. The cell saver machine filters out everything else except your own blood, and then we're able to give that blood back to you as an auto transfusion. And therefore, the overall blood loss for the case is less, and you feel better, you feel stronger, you feel more recovered, you feel less lightheaded after your procedure. Okay, so cell saver is highly recommended for all patients. It's mandatory for those with hemoglobin between 11 and 12, and it's also mandatory for those patients that are doing around 2 or above, because those patients tend to bleed more. Why? Because you had prior liposuction, you have prior scarring, you have prior fibrosis, and that makes a second round or third or whatever it is liposuction typically more bloody, and therefore cell saver is mandatory for anyone doing around 2 or above.
I hear some patients heal very well after Lipo 360. Can you explain the average pain level?
So that's a great question, and the answer is that it's very, very variable. I think just patients different patients have different pain tolerance. I do the procedure the same way every single time. I've had patients who come out of surgery and they're completely comfortable, and then I've had patients that are coming out of surgery and they're kind of like almost like yelling in pain, and we have to give them some additional pain medication through the IV here in recovery before they're able to go home. I'm going to be very honest. Yes, maybe some of it is genetics, maybe some of it is how patients, tolerate pain, but I think a lot of it has to do with anticipation, right? So someone who's never had surgery of any kind in the past, those typically, they don't know what to expect, and therefore they feel higher pain levels, relative to those that say have had maybe like a C-section or something before, and so they kind of understand what it is, and therefore they perceive the pain as less. So a lot of it is mental. And it's true. So if you already go into surgery kind of being nervous and expecting a lot of pain, then the odds are that when you come out, you're going to feel a lot of pain. But if you go into surgery and you're comfortable because you've had a lot of time to speak to the surgeon, you've had everything explained to you, you understand everything, you know that the surgeon is going to take great care of you, and you have positive outlook and positive expectations, then you typically come out of surgery with less perceived pain, and actually in the long run much happier overall. So it's actually pretty incredible what the mind and positive thinking can do. One thing that I was going to talk about, I almost forgot, was that we do the power assisted liposuction. We don't do laser liposuction here, and we don't do vaser liposuction here. So laser is an actual laser, okay, and that creates heat, and vaser actually uses ultrasonic energy, but again, it also creates heat. The reason I don't like to use those modalities is because the incidence of true thermal injuries, so real burns, of true burns is higher with those modalities. And so again, I want to decrease your risk level overall. And honestly, especially with the combination of body type, which we're doing now, and I'm not going to get into body type a lot today. We'll do a whole segment on that for you guys as well. But especially with the combination of body type, I really don't see much difference in the results of using a laser or a vaser as opposed to the PAL combined with the body type. Okay. All right. So we talked about the technique. We talked about the cell saver. All right. Aggressive. Okay. I put that up there because you go into a lot of social media. You go into a lot of these groups, and you hear a lot of women saying, "I want aggressive liposuction." Okay. And so what does that mean, right? So like everything in life, you can't get something for nothing, right? If you're overly aggressive, then you're going to increase the risk profile for that patient, okay? If you're overly aggressive and you leave almost no fat beneath the skin, your risk of lipo burns goes way up. Your risk of contour abnormalities goes way up, and things of that nature, okay? So yes, you want to be aggressive in the sense that you want to remove as much fat as you can, but you want to leave, I always like to leave about a 1 centimeter layer or so of fat beneath the skin, so that you can get, you decrease the risk of lipo burn injuries, okay? And you decrease your risk of fibrosis and other issues. So the other thing that we have here in Florida is that we do have limits as to how much we can remove. So we are limited by the Florida Department of Health to only 4 liters max of liposuction removal in the office-based surgery setting when it's not combined with any sort of procedure. So you can be aggressive, but once you get to that 4-liter limit, that's the limit that the Department of Health has set for you, and you can't be, you shouldn't really go beyond that, otherwise you're breaking the rules, okay? And so if your BMI is starting to get higher than 28, so 28, 29, 30, our max BMI is 33.5. Once you start getting, above that, you're gonna have more than 4 liters of fat total. And so, we're gonna reach that limit. We're gonna contour things nicely. We're gonna do liposculpture. We're gonna give you a nice shape. But yeah, maybe you're probably not gonna be able to remove all the fat that you have to remove. And you just have to know, you have to realize that you have to, if you want more fat removal, you have to come back for a second round 9 months to 12 months later for additional fat removal and contouring at that time. Okay? But what makes me sometimes sad, all right, is that people go to other countries. There's a reason for these limits, okay? Why did the Florida Department of Health limit it to 4? Yeah, other states limit it to 5, and that's okay. Even the Dominican Republic now has a 5-liter limit, where before it didn't used to. But people go to other countries or other, and then they come back with, big lipo burns, all sorts of things, because the liposuction was way too aggressive, and it's sad. So yes, you want to have a certain degree, you want to be aggressive to a certain degree. Yes, you want to contour the body, but if you overdo it, it's going to lead to problems. And the thing that you see the most with overly aggressive liposuction is fibrosis and lipo burns, which if they're large can be pretty devastating. Okay. All right, so you want to go to someone that, yes, is going to contour your body, okay, but they're going to take your safety into account as well.
How long do you suggest post-op faja, and how many massages?
Great. So yeah, that post-op's the next next thing we're going to talk about here. And yeah, we talk about compression and massage. So I'm going to get to that very, very soon. But the last thing I kind of want to mention within the operative kind of segment here is, what are the Florida Department of Health limits that we have? So I just mentioned that if you're doing liposuction alone, or even liposuction with body type, or even liposuction with fat transfer, then the limit is the 4 liters or 4,000 cc's. If you are doing another procedure, whether it's a tummy tuck, a breast tuck, breast lift, anything that requires an incision, even whatever, rhinoplasty, which I probably wouldn't ever combine anyways. But if you're doing any of those other procedures, then the limit is only 1,000 cc's, 1 liter, okay? That is the limit set here by the Florida Department of Health, okay? And that applies to every single surgeon in Florida. So if someone is saying that they're not doing that, they're not following the rules, okay? All right. Okay, so we have so now, yes, we're starting to get some questions about post-operative care, and those are great questions, because this is one of the procedures where the post-op care is just as important as the procedure itself for having the best results, okay? So one of the first things you have to think about, especially after a big liposuction case, so lipo 360, say, plus addition of the arms and the chin or something like that, is hydration. Hydration is super, super important, okay? It's important for a few reasons. The first reason is, if you're not well hydrated, you're gonna feel lightheaded and you're gonna pass out, okay? Even if your hemoglobin level is okay, you're still gonna feel like you're gonna pass out if you don't hydrate, okay? You wanna be drinking 1 to 2 gallons of fluid a day. It's not easy. You actually have to jot it down and make sure you make it, because if you're just kind of drinking, a Gatorade here and a juice there, you're not gonna make it. You're not gonna make it. You're gonna get dehydrated. You're gonna feel lightheaded. You may even pass out. Okay. The other reason is that it helps the skin. Okay. We just did this big liposuction case. We were just there for 2 hours underneath the skin with this cannula being, fairly aggressive. Okay, it's trauma. Okay, it's surgical trauma. It's trauma that you want, but it is trauma. Okay, so yet skin needs to be able to get good blood flow. In order to get good blood flow, you have to be very well hydrated. Okay, So hydration helps the skin. If the skin doesn't get good blood flow, that's where we can lead again to scarring, inflammation, and fibrosis. Okay? And lumpy, bumpy appearances, things like that. So hydration is super important. Okay? It's just as important as the next two, massage and compression. Okay? A lot of people don't realize that. Okay, so the next one, massage. Massage, you need to plan ahead and make sure that you already have identified someone near your hometown that has a lot of experience with post-lipo lymphatic massage. Okay, we have someone here at Pure, so you know, whether you do it with us or someone else, as long as they have experience, that's okay. But we have Coraito here. She has been doing this for years and years and years. She's treated thousands and thousands of patients. She knows exactly what you need, and you can get those massages here with Coraito at Pure for the while you're here. Okay, but then eventually you're gonna have to go home, right? Post-op day 5 is when you get to go home. You can't go home sooner than that. I should have said that probably here. You cannot go home before post-op day 5. Okay, so post-op day 5 you go home, and then you have to continue your massages at home. The minimum, the absolute minimum massages are 10, but that's the absolute minimum. It is not unusual at all to require 15 or 20 or more. You know what is the most ideal massage schedule? I'm going to tell you what the most ideal massage schedule is, but I know that it can be a little bit pricey once you add everything together. But this is the most ideal massage schedule is you're going to get the first 5 massages every single day back to back, starting post-op day 1. Okay, and then you're going to go to 3 massages per week till you get to about 10, and then you're going to go to about 2 massages per week till you get to about 20. And then you're going to go to 1 massage per week as a maintenance until you complete a year post-liposuction. Now, I know everyone's going like, whoa, how am I going to do this for a year? I'm just telling you what is the most ideal massage schedule, okay? I know it's tough. I know not everyone's going to be able to do that. At some point, maybe you can switch to like even having your partner, or you doing some self-massage, or using a roller, which is also you can do yourself at home. So there are other alternatives to that, but I'm just telling you kind of what the most ideal would be. Okay, but massage helps for multiple reasons, and it's actually for different reasons as you move along. Okay, so the initial massages, those first 5 massages, are for fluid drainage, and you usually get that drained out through the drain that I use. Okay, I should have mentioned that here as well. I do use a drain. It's in the lower belly area. We usually get it out day 4 or 5 before you go home. So initially they push the fluid into the drain, from the back, from the front, pushing it all into the drain, okay, and removing that excess fluid. Sometimes, some patients either don't want to drain, or there's some open areas. Sometimes we need to open a little stitch or so to remove that excess fluid. And that's what's going to minimize the risk of a seroma once all that excess fluid gets pushed out. So these massages can, because it's so close to post-op, they can be quite tender, and so therefore they usually don't last much longer than 20 minutes or so, maybe 30. But they're not these long massages because you're feeling quite tender, and we're really kind of pushing hard to get that fluid out. Okay. After that, then the massages become more of a lymphatic massage. So from 5 to 10 is more of a lymphatic massage. The drain's already out, the holes are usually sealed, and then we're kind of pushing the fluids towards your lymph nodes, which are in your groin area. Okay, so you kind of start pushing the fluids towards the lymph nodes. Your lymph nodes then take that fluid, and eventually you excrete that fluid in your urine. Okay, so that's kind of that for that. And then from like 10 to 20 and so forth, it's all about getting the skin to drape back, and it's all about body contouring at that time. And if issues come up, we have some fibrosis or inflammation and stuff like that, then other modalities can be added, such as cavitation, ultrasound, wood therapy, carboxy, and all these other things that could potentially be added if you need to for that.
Can your patients request to not use a drain?
Yeah, for liposuction, which is what we're talking about today. Yes, that's a reasonable request, but when we do that, we have to leave some of the incisions open, and therefore you're going to have that initial drainage through the open incisions. And sometimes, because I trust Coraito, I know that she does things well, she does things sterilely. Sometimes she has to kind of reopen the hole a little bit with the back of a sterile Q-tip, which is what we use here, okay, to then allow for some more drainage, okay? And so if you're really against the drain, then we can work with you on that. But I prefer the drain. I think it controls, it's much more controlled. There's not as much drainage going all over the place, especially those first kind of 48 hours or so. And so I think that's why I like to use the drain just in general. That is one thing that in terms of post-op expectations, I didn't mention, but that first night, even with the drain, you're gonna have a lot of drainage from all the sites, okay? It's because of all that tumescent fluid that we put in. That drainage can seem like it's a fair bit, it can look pink or red, okay? But you're not bleeding out, okay? It's drainage that's coming out, and of course, like the same way that if you put 1 or 2 drops of blood in the toilet bowl and the whole thing appears red, it's similar to this. That's why the drainage appears pink or red. But it is just post-lipo drainage, okay? And it happens with all the patients. So you do want to prepare, you want to have your pads, your chucks, your shower curtains over the areas you're going to be, especially that first night, because you're going to have a significant amount of drainage that night, okay? All right, so that leads us to compression. Okay, so compression basically means faja in Spanish, which is a word for garment, okay? And as many of you know, some of the best fajas for liposuction are originally from Colombia, and that's why we use that word faja so often. And a lot of the ones that we use here, and a lot of the ones that are used throughout the world are actually made in Colombia. Okay, so we're talking about the garment, we're talking about the faja. Now, when you come out of surgery, as soon as we're done with the surgery, we actually put you in your first stage 1 faja, and you have that faja on when you go to recovery. Okay. And then we don't touch it at all until we see you next day, post-op day 1. We check on everything, make sure you're doing okay. And then that day is when after you have your first massage and your first shower, when you put your faja back on, that's when you can put your foams in. Typically there's 3 foams, okay? 1 in the center, 2 on the sides, and then there's a triangle for the back, okay? So those are the ones that we like to use. Sometimes we add a board, but the board goes over top of the foam. So what goes against the skin is the foam, then the board, then the faja. Okay. The fajas come in different stages, all right? So the stage 1 faja, it keeps things snug, but not over tight, okay? Here's something that I'm gonna point out when we talk about complications, and then again over here, okay? Over compression, too much compression early on causes problems, okay? It leads to lumps, wrinkles, bumps, inflammation, fibrosis. It doesn't allow the skin to drape back, okay? So you don't want to over compress too early. That's why the stage 1 faja has more give, okay? All right, so when do you switch to your stage 2 faja? Well, that's typically, once the swelling comes down to a point where the stage 1 just feels like it's not even snug anymore, like it's fairly loose, then you can switch to your stage 2 faja. For most patients, that's usually between, week 2, week 3, okay? And again, the first stage 2 faja, you don't want that to be over compressed either. Yes, you want it to be snug again, but you don't want to do over compression just yet. You don't really want to do over compression, like something like a waist trainer or something like that, till you're at least 2 months out. At least 2 months out, okay? All right. How often do you have to wear that faja? Initially, you have to wear it 23 hours a day. So basically, day and night, you take it off for an hour to shower, to make me relax for a little bit, take it off for an hour, but you want to wear it about 23 hours a day for the first 6 weeks, okay? That's your stage 1 and your stage 2 during that time. After 6 weeks, then you can come down to 12 hours a day, okay? 12 hours a day for at least another 6 weeks till you reach the 3-month mark. Or some people, they like to wear it longer than that. They can wear it 6 months, 9 months, and that's okay. But you don't have to wear it all day. You can just wear it 12 hours a day. Okay. All right. The foams and the boards and everything else. Again, for the first 6 weeks, you're wearing underneath the faja 23 hours a day. After 6 weeks, you can actually take all that stuff out, wear a faja just on its own, like I said, 12 hours a day. Okay. All right. So I think we've kind of hit all the major points there. Okay. All right, so now you know about the terms, you know about what to do pre-op, you know about what to expect in the surgery and our techniques and things like that. And then of course, now you know about post-op, okay? So what's the next thing you gotta know about? Well, what are the potential drawbacks? What are the potential complications and things of that nature. Okay, these are things that you also have to know. All right, so one of the things that we always worry about is bleeding. It is a blind procedure. Okay, meaning that I'm not visually seeing everything that's happening. I have my hand feeling the cannula on one hand, and I have my guiding hand and my working hand. Okay, and those hands work together. All right, but I can't see, any vessels or things underneath, so potentially some patients can bleed more than others. All right, that's why we use the tumescent fluid to minimize the amount of bleeding, and that's why we always recommend the cell saver to minimize the overall blood loss after a case. For most patients, it's not a lot of bleeding, but like I said, round 2 patients that have a lot of fibrosis, they tend to bleed more. Now, fat is not created equal. Yeah. So I can do the exact same procedure, using the exact same tools on 2 different patients, and I can have one that just produces this beautiful, pristine, golden fat, and then the next one produces this bloody fat. And they can both be round 1s. I'm not talking about round 1, round 2. Okay? What made the difference? It's just, the amount of fibrosis and probably maybe the amount of blood vessels and things of that nature that a patient has, and also maybe their tendencies to bleed. Even though their PT was checked and it came out normal, some patients tend to bruise more than others, right? You know this just from living life. You have a buddy that every time they hit themselves they bruise, and someone else that never bruises, right? It's the same thing. So you can use the exact same techniques. Your tumescent fluid can have the exact same formula and everything else, and in the very same day, do 2 liposuction cases, and the fat that comes out looks completely different. All right. So fat's not created equal between patients, and it's not created equal within a patient. Okay. So fat in the belly area, right here, that tends to be fat that's very easy to remove, for the most part. It's easier fat to remove. It comes out pretty easily. It comes out pretty yellow, not as bloody, things of that nature. Fat overlying ribs, okay? So here and here, okay? And of course in the back. Fat overlying ribs is more fibrous, it's more difficult to remove, and it's more bloody. And you reach a point of what we call diminishing marginal returns, right? Okay, so a lot of people could say, well, my area here still feels more fatty than my area here. And it's true, but it's always gonna be that way. It's always going to be that way for a few reasons. A, the skin here is thicker because it's overlying the ribs, just like the skin in the back is a lot thicker, okay? And B, because that is more fibrous fat there. That fibrous fat is much more difficult to remove because of all the fibers that are in there, okay? And if you stay there, you're just going to make things a bloody mess, okay? So for example, just to put it within numbers, if I spend 30 minutes on the belly, I'm going to remove most of that fat, and I'm going to leave you that 1 centimeter of fat underneath the skin that we talked about. I can be an additional 30 minutes just in these 2 little areas here, and not as much fat's going to come out. But I can be there for another 3 hours and get just a marginal little bit more amount of fat and a lot more bleeding and a lot more problems. You don't want to do that, okay? You don't want to do that because A, you don't want to be there that long, and B, you don't want to compromise the safety of the patient, right? Okay, so same thing, the fat in the back tends to be more bloody than the front. So again, it's thicker skin, it's more fibrous fat, so the backs tend to be more bloody than the front as well, especially overlying the ribs in this area. This here, what we call kind of the lower back and kind of flank areas, are not overlying the ribs. That's similar to abdominal fat. That's why you can usually get that waist, as you say, snatched. We can get that waist very, very tiny because that's easier fat to remove. But back rolls, especially upper back rolls, are much tougher, again, because that is more fibrous fat, much more difficult to remove, and the skin is thicker as well. That leads me to another point. Creases. Why do people have creases in the back? Okay, that's because we have very adhesive fibrous bands that essentially connect that skin to the rib, and that creates a crease. Okay, and so when you're in there, you try to break that up as much as you can, but you're not going to always be able to break up all those fibrous bands. Okay, and so it's very difficult, especially for a deep crease that has a lot of fat above and below it, to be able to remove that completely. Okay, and I tell all my patients, I'm going to try, but it's very, very difficult to make this kind of crease go away 100%. Okay? All right, so that's kind of bleeding and things associated with that, and the differences in fat between patients and within patients. Okay? All right. We always worry about DVTs and PEs. Okay? After any major surgery, after general anesthesia, you have to make sure that you're walking after surgery. It's very, very important. Okay? So walking after surgery at least 10 minutes every hour is very important to try to minimize that risk. The other thing that you have to do to minimize that risk is stay here 5 days before you fly out. If you fly out before 5 days, the risk is very, very high. Okay, so that's why if you fly out before 5 days, you're flying out against what we call AMA, against medical advice. Okay, don't do that. All right, your risk is too high. DVTs are blood clots in the legs. PEs are blood clots that travel to the lungs, and those can be potentially lethal. They can put you in the ICU or potentially lethal. Okay. So walking is extremely important, no flying out before the 5 days. And if you have a long flight, a flight over 3 hours, then you should purchase or acquire what we call a sequential compression device. We have one here, it's called the Circulate. I've talked about it before, you may have heard of it. It's awesome because it's wireless and it has a battery life that lasts 8 hours, and that's pretty much any flight. We get people from the UK, we had someone from the Netherlands, we get people from Hawaii, and the Circulate gets to cover them throughout those flights. Okay, so it's basically it's attached to the leg, and it compresses, squeezes and releases. That's called a sequential compression device, and that has been shown to greatly decrease the risk of DVTs and PEs. Okay. It's similar to the machine that we use while you're under general anesthesia in the OR, except for this one, you can take along with you. So anyone who has a flight over 3 hours, we make it mandatory that you get a sequential compression device such as the Circulate. Okay. All right. Okay. So what's next here? So we're going to talk about contour defects, irregularities. Okay. That's always a possibility, but there's different degrees of this. Okay. So small asymmetries are just going to happen. No one is perfectly symmetrical side to side before surgery. Some people are like grossly asymmetrical before surgery, and no one's going to be perfectly symmetrical after surgery. That's just something you have to accept. Okay? If you were to take a mirror and look at yourself and as a perfect symmetry as opposed to the way you actually look, you'll notice multiple asymmetries. If patients looked at themselves in the mirror as hard as they did pre-op, as they do post-op, they would notice, multiple asymmetries, and that's okay. That's what humans are. That's how we are. I've never done liposuction to myself. I've never had liposuction surgery, and my belly bulges out on the left more than it does on the right. The creases, beneath my chest are completely asymmetrical. If you look at my brows, this brow is a little bit higher than this one. So these are things that I notice because I'm a plastic surgeon, and I notice asymmetries. But a lot of people don't notice these things until after surgery. And then they're like, well, this is like a little bit higher than this at once, and all these things, and that's just the way people are built. You're not going to be perfectly symmetrical side to side, and that's something that needs to be accepted. Now, potentially you can have like really big contour abnormalities, and those are usually a lot of it is usually due to problems with overcompression and or not either sufficient massage or inadequate massage. Okay, and those can lead to contour defects and the one that I put down here, fibrosis. Okay, fibrosis is typically an issue of post-op care. Okay, inadequate massages, not enough massages, overcompression, all these things can lead to fibrosis. And then there is also, unfortunately, a genetic component as well. People that tend to keloid also tend to have fibrosis more because whatever it is that's causing the keloid, that kind of exaggerated inflammatory response can be similar after liposuction, and then also lead to fibrosis there. So there is, that component as well. Okay, skin laxity. So this is a concept that that sometimes I find difficulty explaining or getting patients to understand. But it's very, very important. Okay, so liposuction in and of itself doesn't really address the issue of skin laxity. So If you had massive weight loss, you've had multiple pregnancies, you have skin that has a lot of stretch marks, that we typically consider poor quality skin, and that skin doesn't have a lot of elasticity or bounce back. Okay, typically patients that are a little bit overweight. So anything according to the AMA, any BMI above 25 is considered overweight. Okay, so below 25 is normal, 25 to 30 is overweight, 30 to 35 is obese, and above 35 is considered morbidly obese. Okay, so anything kind of above 25, even if you haven't had a lot of weight fluctuations and multiple pregnancies, that skin is also doesn't have as much elasticity as well. Okay, so I'm going to try to do a kind of a demonstration here. So with my own quarantine belly here. Okay, so look at, if you have a shirt, okay, and you have fat underneath there, the shirt looks pretty smooth, right? I don't know if you can see that there, but the shirt looks pretty smooth. Okay. Now you've done liposuction and the skin quality is not that great. Okay, kind of like this shirt here. This is not a shirt that expands much. Okay, and you do this, right? Now see what happens to the shirt. See how it gets all kind of wrinkly like that. Okay, and then on top of that you have a fixed point, which is your belly button. Okay, so you have a fixed point, the belly button, and the shirt kind of wrinkles like that, and it hoods over the belly button. Okay. That is generally due to skin laxity issues. So a very common complaint after liposuction is, why does it look weird around my belly button? Well, it looks weird. It's not usually due to uneven lipo or things like that. It looks weird around the belly button because you have a fixed point right in the middle of the belly, okay, and you have skin which does not retract completely, and it's a little lax in that area, and so you're just gonna hood over and around that fixed point. Okay. If you have mild to moderate hooding around the belly button, a solution to that is body tight. Okay. If you have significant amount, then the solution to that is a tummy tuck. It's not further lipo. Further lipo does not address skin laxity. Okay. You got to do a skin tightening procedure, which would be something like body tight or a tummy tuck. Okay. So that's what happens with the issues with skin laxity there. Okay, all right. So and then the one other thing I want to talk about is Lipo Burns. Okay, all right. So for the most part, a lipo burn is not actually a true burn in the sense that it's a thermal injury, unless the surgeon was using a laser or a vaser. Which does, impart heat onto the tissues, then it's not truly a thermal injury. So if it's a laser or vaser, then yes, that can be a true burn, okay? But if it's something like either just hand or power assisted lipo, then it's usually due to overly aggressive lipo, okay, which devascularizes that area of skin, meaning it was so aggressive against that skin that it cut off the blood flow to that skin, and then that skin turns that very dark, very black color, and it looks like a third-degree burn. But it's not a thermal injury, it's devascularization of the skin due to overly aggressive liposuction in that area. Okay? So that's why you have to be, you have to worry about people that are overly aggressive. And that's why you have a lot of patients that come from the DR and other places, and you see a lot of lipo burns because they're too aggressive and they're devascularizing skin.
What can you do about lipo burns to treat it?
Great question. So that's a good, So it's not good enough just to talk about it, but what can be done? Well, the most important thing is to identify it early. So if you identify it post-op day 1 or 2, then you can do a few things, and a lot of times it heals. And that's why, of course, seeing your surgeon, but also a great massage therapist, an experienced massage therapist is going to be helpful too, because they can point it out to the surgeon as well. When they're doing the massage, they're like, hey doc, I did the massage post-op day 1, I saw this area, I think I'm a little bit concerned, we should, then do these modalities to help it. So what can you do? First, you want to avoid compression then to that area. So sometimes you don't wear the faja for the first 48 to 72 hours, okay? Because if something's already devascularized, meaning it's not getting enough blood flow, and then you're squeezing it more, it's gonna get even less blood flow, and then that's when that skin can turn dark and dies, basically, skin necrosis. Okay? So the first thing is identify it early. Second thing is stop the compression to that area. And then the third thing is treatment modalities. We use a cream that's called NitroBid. It's like nitro paste. It's the same cream that people that get angina, you know, where their heart starts to hurt because the vessels are squeezed, so that's called angina. They put that nitro paste on to do some vasodilation. It's similar. So we use the NitroBid and we put it over that area of the lipo burn. Okay? And then arnica gel, and then you can take an oral medication called pentoxifylline, which again increases blood flow. Okay? So the different treatments are identify early, avoid compression, start 2 creams, NitroBid and arnica gel, and then oral pentoxifylline. Okay? And if you're able to do all those things, a lot of times you can salvage it. And it won't be a full thickness burn. Sometimes you get some superficial sloughing of like the superficial skin, but it's not a full thickness burn, and the skin underneath lives and eventually heals over. Okay? Now, if you don't do any of those things and you don't even know about it till 2 weeks later, by that time usually it's too late. You can try using the NitroBid and everything else, and I think it'll it might make it a little bit better, but it's a little late at that point in time. Okay, so that's why you have to go to a surgeon that you see multiple times before you go. All right, you don't want to go to these places where you just see the surgeon 5 minutes at the day of surgery and never see him again. Okay, that things can happen, and they have to be identified early. Okay, before it becomes a big problem. So you want to go to a surgeon that you see the day before surgery, you see the day of surgery, obviously, and then you see it and you see them twice before you go home. Post-op day 1, post-op day 4 and 5. That's what we do here. Okay, that way any single problem there is, you can identify it early. You also want to go to a surgeon that communicates with you easily. So if, say, for whatever reason we didn't identify anything while you're here, but something happens, when you're home, you want to be able to get a hold of that surgeon right away so that he can address it right away and help you before it becomes a bigger issue. Okay? All right. I think we've covered it all pretty comprehensively. I don't know if there's any burning questions out there because we really kind of went through a lot. But if there are no burning questions, then I'm going to go through a new segment that I'm starting here today, which I'm going to, whenever I have these talks that have a specific subject, I'm going to end the talk with a summary that I'm going to call The Real Deal with Dr. Earle. Okay? And this is about, there's a great surgeon out there, his name's called The Real Dr. Six, and he does a bit similar to that. He calls it, keeping it real. And I think that's a great thing because a lot of times people get misinformation, disinformation, or they get stuff that's not real. Like they get photos that are photoshopped, from the big clinics, sometimes photoshop their befores and afters. IG models, they photoshop their photos. Of course, anything in a magazine is airbrushed and not real. I mean, you look at some of these, these big models in real life, and they don't look like the way they look on their Instagram or on their magazines or things like that. And it's really a disservice to patients because they have that in their mind, and it's not real. And so I kind of want to bring things back to honesty. I want to bring things back to like what the real deal is. Okay? So here we go. Real deal with Dr. Alex Earle for liposuction. All right? Don't believe a lot of the things that you see on Instagram and the magazine covers like we just talked about. There's a lot of Photoshop going on. There's a lot of airbrushing going on. And when you see them in real life, they're not that perfect. Which comes to brings us to the first one here. There is no such thing as perfect symmetry. Okay? If you're a human being, it doesn't exist. Okay? So that can't be the expectation. Okay? If you went, if you had your surgery and your shape just vastly improved, okay, and you went from a 4 to a 9, all right? I mean, that's a great success. That's a great success right there, okay? But if you want to, if what you're thinking is you want to achieve that 10 level, that perfect level, then you can have a tremendous result, and unfortunately, you're just going to be miserable because you keep nitpicking at yourself in the mirror every single day. And that's really unfortunate because you should be able to really enjoy your terrific results. Okay? All right. Real deal. Overcompression is a problem. This is something that people don't really realize. Okay? I've heard of this one patient. She had her liposuction. She started, started overcompressing way too early. By week 3, she was doing like aggressive compression. And then, a couple months go by and she develops this this contour abnormality, contour defect to the abdomen, and is now upset and blames the surgeon, says that she's botched and all these things. Okay, when really the whole issue to the entire thing is overcompression. Okay, so you don't want to do this early. Okay, you don't want to overcompress too early. You don't want to wear waist trainers too early because that's going to lead to problems. It's going to lead to wrinkles, lumps, bumps, and fibrosis. Okay, all right. Liposuction is not a weight loss surgery. Okay, liposuction is not for weight loss. If you come in with a BMI of 29, you're not going to leave the table with a BMI of 22. Okay, so it's not for weight loss. It's a body contouring surgery, and that's why you want the best result. Come in at your ideal weight. Okay, and I'll give you the best long-term result. All right. Liposuction is really not a fix for skin laxity. Okay, if there's skin laxity, then the solution is a skin tightening procedure, which if it's mild to moderate is something like Body Tight. Okay, and if it's more than that, then it's something that requires an excision, such as a tummy tuck or a brachioplasty or a thighplasty or something of that nature. Okay, all right. Post-operative care is just as important as the surgery itself. Okay, you have to commit to all these things if you really want outstanding long-term results. You have to commit to diet and exercise program after surgery. A lot of patients are like, hey, if I wanted to diet and exercise, then I wouldn't have had the surgery in the first place. I don't think that's the way to think about things. You can never achieve some of these results with diet and exercise alone, but that doesn't mean you don't do it. The combination is the best thing of all worlds. So you have your surgery, you maintain a healthy diet, you do your exercise. Because if you do your liposuction and you don't change anything else, and you just start eating again, you're gonna gain weight again. And the funny thing, or I don't know if it's a funny thing, but the reality is that you're gonna start gaining weight in weird places because we've moved the fat around. And so now, say you did your surgery and you gained 40 pounds, and then things look all off, and then again sometimes you get these like, oh, the lipo was uneven, this and that. No. The problem is that you gain 40 pounds, and you're gonna gain them in odd places. And one of the places where you may gain in too is, and I didn't go into this today, I'll go into it briefly, is visceral fat. What is visceral fat? Visceral fat is the fat that's inside the belly where the organs are. That's the fat that you can never fix with surgery. That fat can only be fixed with diet and exercise. And sometimes if you do liposuction and then you start eating, you start gaining weight, it goes to one of the places where it can go potentially is that visceral fat. And then your belly becomes protuberant, kind of like mine during quarantine, right? All right? So that's why you want to maintain your results. You want to maintain your diet and your exercise, okay? So the post-op care is just as important as the surgery itself. It does, that was my next point, yeah. It does not address visceral fat. Okay, the only way to address visceral fat is with diet and exercise. And importantly, it does not address laxity or weakness of the abdominal wall. So if you have multiple pregnancies, you've gone through weight fluctuations, your abdominal wall can be weak. The only way to address that is a muscle repair, and that's done during a tummy tuck. So a diastasis or a muscle repair, and that's only done with tummy tuck. So weakness of the abdominal wall is not addressed by liposuction. Okay? All right. Florida has limits, okay? The Florida limits, like I said, for office-based surgery given to us, to every single surgeon in Florida by the Florida Department of Health, is 4 liters when we're doing liposuction alone, or liposuction with Body Tight, or liposuction with fat transfer, BBL. Okay, but as soon as you make an incision, you add another surgery, such as a tummy tuck, a breast aug, a breast lift, or whatever, the limit comes down to 1 liter, okay? Anyone who tells you otherwise, they're breaking the rules, all right? And I know some patients be like, well, I don't care if they break the rules. I just want the results. And I don't think, that's not safe for the patients. If you're breaking the rules, it's not the right way to go. And I would ask myself this question. Well, if they're breaking that rule, what other rules are they breaking? Right? So, you want to go with someone who cares about your safety first. That they want you to go back home to your mom, your children, and to try to minimize the complications and everything else. Okay? All right. And then the last one, well, I talked about it already, I anticipated myself, but results must be maintained. Okay? Results must be maintained. All right? And that, my friends, is the real deal about liposuction with Dr. Earle. Okay? All right, everybody. So I think this has been extremely helpful.
You answered a lot of questions.
Yeah, extremely comprehensive. We really kind of went through just about everything. We are going to save this live. We're going to put it on our IGTV and everywhere else. And this is going to be a resource that you can go to whenever you have a question about liposuction. In the future, because I know it's a lot. Things may be forgotten, but go back to it. Go to Pure Plastic Surgery. Go to the little TV icon. Okay, the IG Live is going to be there for you to watch at your leisure. Take your time, take notes, and then you'll be prepared for your next surgery. Okay. Well, I look forward to seeing everybody next week on Hump Day with Dr. Earle. Take care. Ciao.